Hi there, it's Lisa Starr with the StarrCast Podcast. I'm here today with someone I'm so excited to talk to because they are from the medical field. And this person is someone I've known a long time, but we haven't really ever had a mini work conversations anyway. So I'm happy to introduce Dr. Daniel Soffer. He is a full-time clinician internist, and he is also a lipidologist specialist. That has come to him in the last 10 years, I'd say, but Dan will fill us in. And he is a writer and educator and goes around the country talking about lipids. So we're going to learn something about lipids today, and also Dan's journey from high school into how did he end up in a wellness related industry. Anyway, welcome, Dan, and thank you for being here.
Thank you, Lisa. I'm joyed to be here with you. I love talking to you about things pertaining to wellness and to and life in general. And so what a great way for this all to come together.
Well, as we said, Dan and I have known each other a long time, and we actually passed each other while I was dog walking a few weeks ago, and we had conversations, as we often do. And as people are doing at this time, Dan said, "Hey, how's it going in the spa and wellness industry?" And I said, "It's going gangbusters." I mean, we've never been so busy. We have so much attention of the consumer right now who realize that their health is in their hands. But I'm interested in the physician perspective on that. And Dan said, "I can speak to that." But as we do in StarrCast, I wanted to sort of go through Dan's journey into where he is today, starting back in high school, where I assumed he wanted to be a physician. And he said, "Not really."
Yeah, it's funny that you want to start in high school. I did not know what I wanted to be. I did have some medical fields in my family. My father's a dentist. My mother's a dental hygienist. I definitely knew that I wanted to be in a helping profession. So that for sure I knew. I didn't know what that meant exactly, but I knew that I had a particular level of empathy that was meant to be used in a professional way. Mm-hmm. And I knew that because of feedback I had gotten throughout my entire life in upbringing. I also was drawn to teaching. And although most of my early teaching was things like, tutoring other classmates and were younger students, and tennis teaching. But I always loved tennis. I always loved to be in teaching, always loved to be teaching. So I knew I wanted to be helping, and I knew I wanted to be teaching. And that I knew in high school, and I knew that when I started college as a psychology major at the University of Pennsylvania. Mm-hmm. So beyond that, didn't know.
You didn't know. So psychology major, you are expecting to go to grad school after that, I'm assuming.
You'd be surprised how little I had it by way of expectations of what the next thing was. I did not know. I did not have a plan, did not have a specific plan.
So was there some point in your college education where you saw something that made you think, "Oh, I want more"? Or, what was the genesis of you going into being a physician?
Yeah, Penn's psychology department is a fascinating place. I would love to be in it now because of my own personal interests in behavioral economics and behavioral psychology, but I didn't appreciate it as a 17, 18-year-old starting out exactly what it meant, and I didn't know what that was all about. So academically, I'm super interested in it now, but as a teenager, didn't mean anything to me. And so I was sort of floundering, I think, in the department, looking for mentors, and did not have anyone who I really felt close to in that way. And it's a big department and a highly competitive department.
For sure.
And then I was taking a biology class just to sort of tick it off my list of like requirements. And I was blown away, just absolutely blown away, actually, by a professor who was also an acquaintance of and a patient of my father's. And so he took some time to orient me towards what it meant to be in the biological sciences as opposed to the psychological sciences. And he took a liking to me, and he he was a incredible mentor. Actually, a local Rose Valley resident and school in Rose Valley benefactor, and that was one of the connections. And he was also frequently named as a potential Nobel Prize winner, but never was awarded that position. But he was a really important mentor to me.
So this taking biology blew you away in the sense that you really enjoyed it and you were like, oh, I want more of this.
Yeah. I mean, the piecing together how things work was just, my curiosity had never been piqued in the same way as a high school student. I was a very curious elementary and middle school age child, but by high school, maybe not as much, a little distracted by, maybe hormones or something.
Well, come on, in high school, we know everything already anyway.
Exactly. Yeah. And so, but this really piqued my curiosity in a way that really just resonated for me. And all right, well, but at the risk of sounding a little goofy, I will tell you that I actually sort of came together almost as an epiphany. And I hate to say it as a calling, but I really felt it as a calling once it sort of occurred to me that this is what I had to do. And again, with the risk of sounding a little too flighty, I actually literally had a dream where I saw myself in that role. And I said, it was that from that point on where I knew that's
awesome.
right.
Your subconscious was sending you a message. This is the path. And
Thankfully.
I'm sure your parents were not disappointed to hear that you wanted to switch to pre-med.
They never directed me one way or the other. They never said to me, you should do this, you should do that. There was always an assumption that I would go to college, but they didn't tell me where to go. They didn't offer any advice or opinion about it. They didn't suggest a specific field of study.
Oh, that was nice. They didn't pressure you that way. So this biology epiphany happens, how far through college are you?
Like second year.
So you were able to switch your major and complete on time your undergrad. Yeah,
I still completed as a psychology major, but all of my electives were in the pre-medical sciences.
And so then what happens? Do you take time off in between med school, or do you head right for med school? How did that work?
Oh yeah, I was dying to start teaching. I was really craving the opportunity to teach. I wasn't really craving the opportunity to start medical school. I knew I felt like I needed to evolve a little bit more. And then my wife, Gwen, at the time, she had an opportunity to do graduate school in Spain. And she said, hey, let's go to Spain for a year. And I was such an idiot that my first reaction was, no, I don't want to postpone teaching. I'm dying to get out there teaching. All for about 30 seconds. And I realized, oh yeah, going to Spain for a year would be pretty cool. But my first reaction really was not like, oh, wow, that would be great. And it was really, so we did spend a year there. And, so I got to play soccer and drink beer and not really focus too much on anything. But I'll tell you, by the end, I was really craving getting back into what I really back on my path.
Were you able to, while you were in Spain, apply to med schools or sort of advance the agenda that way?
Yeah. So I could apply from there, and then even spent another year when we got home in a direct teaching role as teaching biology and sciences at a local school.
So you go to med school, and did you choose a specialty at that point?
No, because I did not come from the science world. Most of my classmates, I will say, were deep in the hard sciences, biology, biochemistry, chemistry, that kind of thing. And I did feel like I was playing catch up for the first 2 years. And indeed I was. I mean, I would be in a biochemistry class, seeing this information for the first time with people who had PhDs in biochemistry.
Oh boy.
And, so you do feel a little like overwhelmed by that. Although I will say that now, a generation later, the medical schools seem to go out of their way to find people who are not fully entrenched into the hard sciences. And so, but that wasn't necessarily the case in the, early 90s.
Right.
Yeah.
So you complete med school, and what happens next? How did you find your calling at that point?
Yeah. So the second 2 years of medical school, you spend doing clinical rotation. So the first 2, you're in the classroom learning the alphabet, and then the second 2, you're learning how it's applied to humans. And you can also determine whether or not you want to be a clinician. So a lot of my classmates decided, I don't want to be a clinician. I just want to do research, or I want, some combination of those things. And then you find your people. I hear medical students talking about wanting to find, the right thing, understand what science is that interests them the most. But ultimately, I think what happens is you find your people. You do these clinical rotations. During the rotation, you think to yourself, boy, I feel comfortable with the people who do this who do this job. I'm most like them. And so what happens is, over generations, is you get stereotypical personalities in fields. And when people, and it's a problem, because you'd like to the world should be your oyster with regards to how you want to pursue your career, and not necessarily just do something because everyone who does it is just like you. But people are people. That's what they do. And
we're attracted to people that are like us.
Yeah, I think that really is the case in medicine in particular.
So you felt strongly that you wanted to work directly with people, with patients, and not in some remote setting.
Yeah, I knew I wanted to be a clinician. I mean, it goes back to how I wanted to live my life. I knew I wanted to be a helper, and I knew that meant being a full-time clinician. I also, I was a bit academically lazy at the time. I know that about myself. I knew I didn't want papers that I had to complete, something over my head at all times. I loved the idea of, you go into work with a blank slate, you do all the work you need to do at work, and then at the end of the day, you close it all out and you start again.
And you don't have homework.
Exactly. And that was really appealing to me at the time. But and this is something I know we'll get into, is the 7-year itch. You get the grind of what that means if you're a full-time clinician, and from sun up to sundown, you were just nonstop helping and solving problems and one-on-one with people. It's exhausting, and there is, I don't know, there's something magical about that 7-year time frame that you see it over and over again, and you must see it in your career. And
I think so. I think that you're right in the sense of what you do is so difficult. I mean, being an internist, seeing however many patients a day, how many would you see in a typical day?
About 20.
Yeah. So 20 patients a day, and everyone with a different issue or problem or angle, which is, fun. It's the fun part of being a consultant, is that things are the same and yet different. There are different circumstances for each engagement, but it is tiring, I'm sure. And so, you're toiling away as a clinician and making people feel good, but 7 years in, your itch came. What happened then?
I want to add that I also had a friend of mine chirping in my ear saying, how come you're not doing more teaching? And how come you're not out there on the education trail? And how come you're not writing papers? And you know who that person is, Lisa. That was you. That was you. That was you chirping away.
Oh, thank you. Well, like I said, Dan and I have known each other a long time. Our children are the same ages. We took vacations together. And Dan, you taught me a lot about the life of a physician. And, I admired that fact that you went to work, you did your work and came home, but I saw that you had so much more in you, so your 7-year itch came and you decided to do what?
Well, the timing was really, I think I mentioned before, I'm not a great planner. I like to sort of put myself into a position and say yes to opportunities and make sure I recognize opportunities. And that was happening around the same time. There was a confluence of issues that sort of came together that enabled a change in my career. One, the recognition that I needed to make a change to keep myself sane and healthy for the long haul. 2, we were transitioning from paper charts to electronic charts, which meant greater mobility for me. 3, we were also no longer doing hospital-based work. So in primary care internal medicine, you can either take care of your own patients in the hospital or turn that care over to what at the time was a growing field of called hospitalists.
Right.
And to put it in perspective, my first year in residency was the first year that my program trained a hospitalist. Mm-hmm. So it was a brand new burgeoning field that, graduated someone the same year that I graduated. And so right around that 7-year mark, it was starting to become how doctors took care of their patients, that when they got hospitalized, they get turned over to the hospitalist.
So you weren't tied to a hospital.
Yes, which meant that I could be in more than one place and not have to go to the hospital every day. As a matter of fact, when we were tied to the hospital, there were times where I went there 3 times during the day. I went in the morning, I went at lunchtime, and I went after work. And we weren't in the same building, so I had to drive each time, and physically just very demanding, and would not have left any extra time or space for me to do other things other than just be a full-time clinician, which was fine. I mean, I did enjoy that, and I liked combining the outpatient and the inpatient work, but it was.
You saw this opportunity to do something a little differently.
Yeah, I also had a growing interest in cardiology and preventive cardiology, and in as a lipid specialist. And that was the same time that the National Lipid Association created a certification pathway, something called the American Board of Clinical Lipidology. And then there's an accreditation pathway for people who are not medical doctors to also get accredited. Mm-hmm. And so there's 2 pathways to become a certified clinical lipid specialist. And I was in that first graduating class to get certified in that field. And so all of these things came together at the same time that my now colleague had seen me at a meeting and said, Dan, we would love it if you joined our group in preventive cardiology. Mm-hmm. And honestly, it was the confluence of a lot of unforeseen factors that happened at the same time that enabled me to find a way with a benevolent chief who said, yeah, we want to find a way to make you as happy as possible. And how about we lease half of your contract to this other program? And I said, great, make it happen. Yeah. And so really for the last 15 years, that's what I've been doing, 16 years. Yeah.
So it's funny, the story that you're telling about luck, and the element that plays so often in the stories of the podcast guests that we've had, because we often don't set out on a certain path. And sometimes you have to recognize the opportunity and just take it. And, you were smart to notice, hey, things are changing. Here's an opportunity and I'm going to take it. Could you, for our listeners who are not from the medical field, just spend a moment in explaining what's a lipid?
Yeah, for all intents and purposes, it's they know it as triglycerides and cholesterol. And so those are the 2 main circulating lipids of medical importance. And how much you have in circulation depends on a lot of different medical and metabolic factors, some of which are inherited, some of which are acquired, and most of which are some sort of combination of the 2. Mm-hmm. And if you have too much of one, not enough of the other, and in the wrong combination, it may predispose you to having cardiovascular disease. And for some of our patients with severe inherited problems, they can develop cardiovascular disease at very early ages in life. We have patients who have had heart attacks as young as 4 years old. And we have patients who, look like they should have cardiovascular disease, but may do quite well and not have cardiovascular disease until much, much later in life. Mm-hmm. But it has a big impact on cardiovascular health, the risk for having heart attacks, strokes, and other vascular problems. There's overlap with endocrinology. Triglyceride disorders in particular are associated with insulin resistance and diabetes and obesity and some other medical conditions. And severe high triglycerides, especially when made worse by inherited disorders, can predispose you to a condition called acute pancreatitis. So there's other physical and medical manifestations of lipid disorders, but cardiovascular disease and acute pancreatitis are the two main ones that occur as a result of bad, severe derangements in the lipids.
So these were things that any physician could address. I mean, I know when I go to my doctor for my checkup, they look at those things, but as a lipidologist, you have a much more intimate knowledge, I suppose, of how they work and what the outcomes could be. And this moves you more into that realm of preventive medicine, which I'd like you to speak to, going from your clinician practice as an internist, seeing people who are sick or have an issue, to a realm where you're maybe helping them foresee and change behaviors to avoid something.
Yeah, that's a great point. So, in primary care, you're primarily taking care of the central portion of the bell curve in the population. Mm-hmm. So 97% of that population is going to have variation, but within a range. And that range is going to, can be fairly wide or narrow depending on what you're talking about. But, almost everybody is going to fall into that category. And as a clinical lipid specialist in a clinical lipidology practice, I'm responsible for those patients, but I'm also responsible for the people at the tail of that bell curve, the real outliers as well. So we see patients with the severest derangements of all, plus also people like you and me who don't necessarily have a severe inherited disorder. We just have the normal risk. Mm-hmm. So if we're just talking about cardiovascular disease, the normal outcome is that about half of all men and more than a third of all women are going to, at some point in their life, develop cardiovascular disease. Mm-hmm. So we're not talking about like the occasional person. This is a condition that it's a ubiquitous condition. It affects all of us. Now, the rate that we develop it, the age that we develop a complication, that's where it varies. And for many people, it's a geriatric problem. And that doesn't lessen the condition at all, but it changes the way you might manage it when you're 20 and 30 and 40 years old versus how you would manage it when you're 50, 60, or 70 years old. And so one of the worst cases, though, is people who aren't outliers, but who just look like they have some minor derangements can present at much earlier ages, not necessarily at 4 years old, like I mentioned in that extreme example, but, at 30, 40, 50 years old, the sudden cardiovascular event, how would you have acted differently if you could see that patient before they had their sudden heart attack that killed them? And so there's a big overlap of normal and the severity of the outcome in the normal. And there are good predictive models we have for identifying who's more likely to have that event across their lifetime. Mm-hmm. And if so, who's more likely to have it at a younger age compared to later in life, and how best to intervene.
Mm-hmm. So in your lipidology practice, you're seeing patients who have probably been referred to you by other physicians because they have some abnormalities in their numbers, but maybe they're not sick yet. Yeah. And so you have the opportunity to discuss with them, okay, here's what I see, and here is your path of action going forward. Is that how it works?
Yeah. I mean, the cardiovascular disease that we see is actually pretty complicated. So, as a lipid specialist, I do see the world through my lipid goggles, of course, but, the lipid derangements are one aspect of cardiovascular disease. And there's a lot of other facets to how it develops, for example, just the biological factors like diabetes and smoking and high blood pressure and aging, and then the genetic component. So those are all important factors. And even though we're in a lipid clinic, we focus on the lipids, we also, the clinic itself is referred to as preventive cardiology, so that I can help my patients manage all those things. Mm-hmm. The more severe their disease, like meaning the more plaque they have that leads to those heart attacks, the more intensively you need to manage their care. And that's where, adding a lot of medicine is a critical part of their care. Mm-hmm. And where the lifestyle mitigation has a much lower impact on their cardiovascular events. Whereas if you catch people earlier in their life, or at least earlier in the development of their plaque, where the plaque is immature and it's just burgeoning, that's where minor changes in all of these factors can have a huge impact on their lifetime outcome. So a small change in, for example, in the LDL cholesterol for somebody with advanced plaque has almost no benefit to them. You need to have a major change in LDL cholesterol. It's too late. A 10% change has no impact, but a 50% change, a very significant impact. Whereas that person earlier in life, 30 or 40 years before, a 10% change can have an enormous impact on their lifetime development of that disease. And so a 10% impact, a 10% change in the LDL cholesterol is easy to achieve with lifestyle modification without using any medication. And, so we have the opportunity to balance all that for the patient.
Well, we're at this inflection point. It feels like what we've seen happen in spa in the last 10 years, going from just getting facials and massages to really learning how to take better care of yourself. When we, in the spa side, when we give someone a treatment, we're still talking to them about what you do when you get home, which is drink a lot of water, make sure to move, because we can't manage their health from 1 hour in a spa. And they come to us maybe once a month, where they see you perhaps once a year. We know that so much of this disease, and cardiovascular in particular, is lifestyle driven. There is, of course, the genetic component, as you mentioned, but how can we work together, the spa and wellness side with the medical side, and help ensure that we get people's attention, especially now, Dan, because we're seeing on the spa side that we do have their attention. They're realizing that, if I take a little better care of myself, get more massages, watch my blood pressure, I'll be healthy longer and I won't get debilitating illnesses. So I'm interested in the path forward and your perspective on that right now.
I have to say I have less insight into that than you might hope for. I do know that lifestyle change is well known to have a very important impact on cardiovascular outcomes at every stage, and optimizing your attention to that is critical. I do feel like there's some selection bias, that if you take people who are already going to the spa, they're already sort of focused on that issue to begin with. And so, they are much more receptive than I think the general population who may not be doing that. I don't think there's a lot of magic involved. I do think that there's a lot of flexibility in terms of how you optimize healthy lifestyles. And it starts with, eliminating a lot of the excess in life. And that's the really hard part. It takes a lot of time and effort to avoid the excesses. But even if you're just doing the basics, like, trying not to drink too much, and making sure that you drink enough water, and making sure that you're exercising enough during the week, there's still lots of room for making change. And I have to say, I feel like the medical community doesn't have a firm grasp of what makes you exactly healthy. I think we're much better at reducing disease burden than we are at making people healthy. And maybe this is where the spa industry and the medical industry can come together, because the spa industry may actually have a better sense of what makes you healthy, what makes you feel good, which is different than how do you treat this disease.
Well, and now we bring in the mental component, right? Because there's the physical manifestation of something, but there are the mental behaviors that drive it, or perhaps cause other unwanted effects like depression. I was so happy to read just this morning that there are doctors in Belgium who are prescribing visits to art museums for people who have depression or mental, hesitancies, let's say.
Yeah.
And they're going to prescribe them to go to museums, and they're going to track this group and see if anything changes. And I thought, well, that's so great.
Yeah, I love that idea. I have to say it's very creative, and I've never prescribed attending an art museum before, but maybe I'll add that to my list of things that people should do. I like that.
Well, for sure, we have to try different things, right? Because what we've been doing is obviously not working, as we see illness just continue to go up in the United States and globally.
I do have a 1-page handout that I've written years ago, and I think I've edited it fairly recently. It talks about healthy lifestyle, and healthy behaviors, and I keep it very general because I think it's hard for medical people to be very specific about like eating one particular type of food or avoiding this other thing. But I do make the point that having fun and taking pleasure in life is a really important part of good health, that it can't all just be about getting stuff done and accomplishing tasks and avoiding pain. There's also that the flip side of that finding pleasure, finding love, being supported by people around you, and that's very important part of good health, of course.
And so I love that you said that, Dan. In closing, I'd like to hear about how your choices have enabled that for you. You went from that full-on clinician, 50 hours a week, and you made choices to work in a different wellness aspect. How has it affected your own life, those choices that you made?
Yeah, well, some by choice and some by luck, as you point out. Early in my career, I didn't mention this earlier, but we had our children while I was still. We had all 3 of our children by the time I finished my residency. And so one of the reasons that I wanted to stay close to home and be a full-time clinician, it was so that I could be there as much for my wife and kids as possible.
We need to make sure those kids could play soccer well.
Exactly. Yes, that was very important. So staying close by at that stage in their career. And when I was preparing for my certification, I realized the only way I was going to be able to complete that was to start waking up a lot earlier than I do, because that's the time where I had to do that work. And so I converted myself from sort of a night owl to this morning person as part of that process. And that's something that has that has stayed with me for the last 16 years. So I'm up, very early in the morning. I get a lot of work done early in the morning. I do a lot of writing and editing and preparing, and that's when I do use that time. And then I have certain days during the week that I've carved out into my calendar that these days I am going to exercise before work. I don't know about you, Lisa, but at 6 p.m., my legs don't work and my brain.
I am not an evening workout person either. No.
I am spent by the end of the day. I mean, I've tried playing soccer in the evenings and literally just my legs don't work. They are non-functional. So I have to get my exercise early in the day. And I'm fortunate enough in my career that I can set my own schedule. And I've carved out certain days during the week where I can block out time to do that and still not compromise my academic needs and need to do these other things early in the morning. And, that was by choice, but also I sort of lucked into this thing where I was able to do that. And I know that most of my patients, when I'm counseling them, they have to be at work at a certain time every single day, and they don't get to choose what that time is. They can't flex that. Now the pandemic has granted a lot of them a different freedom in a lot of ways, right? They don't have that 2 hours of commuting every day anymore. They even have an opportunity to break away at lunchtime and take a walk and do other things. So there's some things that were unforeseen by the pandemic. Now they're also working down the hall from their kitchen and pantry and refrigerator full of food. And I'm challenged by that myself. The snack that's in the pantry is sort of calling my name while I'm trying to work, and it's very distracting. Yeah. But
you think that people have had more time to spend on their own personal wellness as a result of the pandemic?
Yeah, I do. I've actually seen some pretty dramatic improvements in health and wellness for a lot of my patients. I would say I'm just ballparking it at around a 2-to-1 ratio of people who have improved their health significantly to people whose health got worse significantly. Most of us fall somewhere in between, but for every 2 people I saw with really fantastic health improvements, I've seen at least one person whose health deteriorated. They've gained 50 pounds and had all kinds of other mental and constitutional problems because of the isolation
Mhm.
and difficulties.
Well,
So,
at least it's more on the positive, right? I mean, more
yeah,
people doing better, and hopefully
that's my impression.
they'll
Yeah.
continue on that route. Well, Dan, thanks for taking time out of your very busy schedule to join us and talk about your personal path. It's really interesting to hear how someone balances the demands of a medical career with personal wellness and joy and playing soccer and all the things that that entails. But what I'm hearing is that if you pay attention to what you need, your human need, and take the opportunity that you see, your path should be more clear to you.
I like that, Lisa. Thank you.
Like that? Okay.
Yeah,
We'll say that's what works.
I like it.
All right. Well, thanks again, Dan. It was good to see you, and thanks for joining us on StarrCast.
Thank you, Lisa. I appreciate the opportunity.